Good evening, and thank you for making the time to join us for this important conversation as part of our Let's Talk Health series. My name is Anika Jackson, and I serve as Family First Health's Vice President of Diversity, Equity, and Inclusion. So tonight's conversation, as I said, is the third in our Let's Talk Health series, brought to you by Family First Health in collaboration with WellSpan Health and the York NAACP. Let's Talk Health is a series presented by Family First Health to engage the community in candid conversations with medical experts to build knowledge around topics related to health. Through Let's Talk Health, communities can connect with healthcare experts and ask their questions live during the session, so get ready. Tonight's session is focused on the impact of COVID-19 on children and adolescents. We're excited to have two local medical experts with us here to help us along with the conversation tonight. So I'll introduce them now. Our first medical expert is Dr. Oluwatomi Uwazota, affectionately referred to as Dr. Tomy. Dr. Tomy has joined us for previous Let's Talk Health sessions and currently practices at Family First Health. Dr. Tomy earned her Bachelor of Science in Chemistry from Howard University, her medical degree from Howard University College of Medicine, and her master's degree in public health with a certificate in global health and course interest in maternal and child health from Johns Hopkins Bloomberg School of Public Health. She completed her residency at the York Hospital Family Medicine Residency Program and is certified by the American Board of Family Medicine. So welcome, Dr. Tomy. Glad to have you back with us.
Thank you, Anika.
We also have joining us tonight, we're very excited to have Dr. Almera Contractor. Dr. Contractor received her undergraduate degree from the University of Maryland, Baltimore County, and her medical degree from Autonomous University of Guadalajara. She completed her residency at Westchester Medical Center and is certified by the American Board of Pediatrics. Dr. Contractor currently practices at WellSpan Community Health Center. So welcome, Dr. Contractor.
Thanks.
So I am very excited for tonight's conversation. I have had the privilege to talk with both Dr. Tomy and Dr. Contractor in preparation, and I know that they're ready to engage in a dialogue between themselves, but also to answer your questions live. So I'm going to give a little background as I have with our previous sessions, just to get us all on the same page about where things are related to COVID and some nuanced pieces related to children and adolescents, and then we'll move forward with the conversation. So as we know, the COVID-19 pandemic has hit many of our communities hard, and there are various populations that have been hit differently. Tonight's conversation again is around children and adolescents. So our children are vulnerable, right? We know that our adolescents are able to be vaccinated. Not all of them have, just like adults. And we know that our children are not yet able to be vaccinated. So part of the conversation tonight will be about some of the things related to considering the risks versus the benefit of vaccination for children and adolescents, but also other ways we can keep our children and adolescents safe. So with school reopening and sports underway, there's a lot more exposure out there. So this is really important for us to get down into it and understand some of the nuances along the way. So some basic information. I'd like to walk through some case rates, some information about vaccine supply and access in our community, specific to the York community, vaccination rates, and testing. So case rates. Pennsylvania now has more than 1.4 million confirmed and probable COVID-19 cases and more than 29,000 deaths due to COVID. There have been 57,361 confirmed and probable cases in York and 913 deaths, unfortunately, in York. Across Pennsylvania, there are 71,331 cases, or there have been, for ages 0 to 9. So those are our youngest of the young. And then 167,504 cases for ages 10 to 19. So hearing those numbers, that makes tonight's topic relevant. So we're excited to really get in and answer your questions about some of that. In terms of vaccine supply and access, vaccine supply in York is stable currently. I know in some of our previous sessions that has not been the case. We have various healthcare providers and pharmacies available for appointments and walk-in vaccination. So we have, for Family First Health, we have our York City Vaccination Clinic, and our team can put some of this information in the chat for you about how to access that. Also, WellSpan has access to vaccination across various sites. So many of these are appointments, but also walk-in. So we have really, really made a lot of progress in terms of accessibility. And we, as a community, I think have done a really good job of coming together and figuring out how to meet people where they are and gotten creative about how we can partner on some of these things to reach those communities. We're offering at Family First Health, and I want to give a shout out to our mobile team, mobile vaccination. We have a trailer that goes out into communities, different organizations and events, and they are working really hard too across York, Adams, Lancaster, and Lebanon counties to reach those who need or want vaccination. In terms of vaccination rates, Pennsylvania has administered close to 13 million total vaccinations, and that's including those boosters that you're hearing about or third doses. And of those vaccinations, 6.2 million residents are fully covered, with 63% of the population having received at least one dose across Pennsylvania. If we boil that down to York, which is the focus of this session, we've administered close to 240,000 total vaccinations, with about 57.7% of the population having received one dose. So we're making progress. I know our last session was some time ago, but we've made tremendous progress since then, but still a ways to go there. Testing remains an important part of our effort to limit the spread of COVID during this time. And so something that is, I think, challenging the system in some ways is access to testing. However, there are ways to get tested. Many of us have heard about rapid testing and those kinds of things. Those do exist. And there are also ways to access testing through Family First Health. We have walk-ins at our sites throughout the week. And then also WellSpan has ways to access testing as well. So our team has that information. We'll put that in the chat so that you can access that and click all the links. I'm not going to get into the details right now. So just wanted to give some of the basic information to set the framework for where we're going today. So now let's get into it. All right. So I want to just reiterate that this is intended to be your session for the community. So start out with Dr. Tomy and Dr. Contractor having a dialogue between the two of them about things that they're seeing and hearing and responding to some of the questions that they've been hearing. And while they're talking, if you have a thought, a question, put it in the chat. We'll be keeping note of that as they have their brief dialogue, and then we'll open up to that Q&A. So on the intro slides, we had shared you can chat in, you can text, you can even call in. I know that some people laugh about that, but you can call in and you can even email us. So if you have any questions along the way, burning questions, get those to us and I'll keep a log of that. So Dr. Tomy, I'd like to turn it over to you and allow you to lead the dialogue with Dr. Contractor, and I'm excited to hear what you guys can share with us. So I'll be back in a little bit.
All right, thank you, Anika, and thank you to the media team and everybody that has been a part of making this possible, giving us this opportunity to listen to members of the community and to hopefully answer some of their questions and concerns. I'm also especially excited to be here with Dr. Contractor. I have known Dr. Contractor for several years now, first as her student during residency, And then when we learned that we were going to be having our child, Dr. Contractor was the one I trusted to be my child's pediatrician. So I have great respect for Dr. Contractor, not just as a teacher or an excellent physician, but as a really, really thoughtful and genuinely kind person who does her best to look out for the best interest of her patients. So I feel honored to be speaking with you on this very important topic of keeping our children and adolescents safe in a new COVID world, actually old new COVID world. So I think, like I had mentioned to you in past conversations, at the end of the day, I strongly believe that most people just want to keep themselves and their families, their children and their families healthy and safe. And with all the information and misinformation out there, it's not always clear to them how best to do this. So some of the things that I've heard my patients grapple with, I feel like my patients have grappled with different aspects of protection. And I'm going to start with the issue of COVID vaccines. So as most people in audience probably know, the Pfizer-BioNTech COVID vaccine currently now has full authorization for administration for people older than 16 and emergency use authorization for children aged 12 to 15. So I would like you to speak on how parents with children in this age group can think about some of the benefits of vaccination and some of the potential side effects, or both the common and the serious, more serious side effects that they could get from the vaccination.
Thanks, Dr. Tomy. Actually, this is a topic that comes up on a daily basis. I speak to my patients all day about their concerns, and I can definitely respect the fact that parents have lots of reservations and lots of questions about the vaccine, and I don't blame them. There is a lot of information that is thrown to us via the internet, and it's really hard to keep up with whatever could be new and what is true and scientific. So first of all, the most important thing to do is always to remember to speak with your provider. Whoever you trust, whoever you've been seeing, is the one you really should turn to if you have specific questions about vaccine. That being said, know that your provider is always, their best interest is always your child's best interest. So anybody that you turn to for advice, definitely want to make sure you have the right science behind the advice. With folks 16 and over, it is definitely a vaccine that has been recommended, and now it is approved, and not just emergency use, just like Dr. Tomy mentioned. The children trials that were done in the younger ages, so 12 to 15, also have led us to have the emergency use authorization, primarily because they have been so effective. So one of the things that I tell parents is that when we think of an infection like COVID-19, we know that everybody has different levels of illness with it. But you never know if your child is going to be the one that gets affected the most. You never know if your child's best friend, or if your child gets sick and someone around them gets very ill. So our goal is always to protect everyone, to protect the community. You also want to make sure that you're making choices that are safe for your own family. So that being said, for children 12 to 15, the trials have shown that actually the vaccine is 100% effective, which is a pretty significant number. There's no other really vaccine that we have that's so effective against significant illness from COVID. But I know that's not enough to convince everyone. I know that there are people who have concerns about the speed of trials, the speed in which the vaccine was created. And to put people's mind at rest, even though the vaccine is new, the mRNA vaccine is new, the science behind it isn't new. It's been there for decades. So this actual process has been studied for quite some time. Maybe not for COVID vaccine, but to use the same science to treat other things such as cancer and so on. So the science has been there. So it's not really completely new. The other thing is, it's true that it was produced, it feels that it was produced very quickly, but think of it as a worldwide effort. The whole world was really trying to get this vaccine produced in time, people working around the clock with all of the finances available, whereas normal vaccine production has always taken a lot of time because of trying to find finances, people, and support for vaccine production. So there's a lot of science that goes behind it. So it does come down to a matter of trust. And if you can trust the science, then definitely it is recommended that children over the age of 12 get vaccinated. The American Academy of Pediatrics recommends it, the CDC, every major science organization would recommend vaccination over the age of 12 at this time.
Thank you, Dr. Contractor, for the comprehensive answer to that question. And I'm glad that you mentioned that the benefits was not just for children, it was also for families and the communities. But as you've probably seen in your practice, a lot of people are concerned about side effects for children that age. So do you mind, talking a bit about some of the potential side effects, what parents should look out for, what types of things should warrant an emergency room visit or an urgent call to the primary care doctor? And also feel free to talk about myocarditis, pericarditis, because I know that's been in the news a lot.
Of course. So some of the common side effects would be those that you would expect with any vaccine. So clearly, when you get the COVID vaccine, you would want to make sure that you had that you were able to sit after the vaccine for at least 15 minutes or possibly 30 minutes, because some folks who have a higher risk of allergic reactions to anything may be asked to stay longer. Most significant allergic reactions will occur within that time frame or within the first 4 hours. And those would be things that we always would look for with any medication or any treatment: throat swelling, hives, difficulty breathing. Those are all obvious allergic reactions. Now, the common reactions you'd get after the vaccine would be, again, those that you might get with any vaccine. You'd get pain, maybe a little swelling, some soreness in your arm. You might even develop some body symptoms. So besides the arm, you might get some fatigue, some tiredness, just the headache, a little bit of muscle pain, some chills, maybe even nausea. These are all signs that your body is developing an immune response to the vaccine. So these are all actually good signs that don't have to be treated with acetaminophen or ibuprofen. If you feel miserable, then of course you may take any of those, but we don't usually take those before getting the vaccine because you want your body to have the full response to the actual vaccine. So those are the common reactions we see. There have been cases reported of myocarditis and pericarditis. And for folks who don't know specifically, the myocarditis is inflammation in the muscle of the heart, and then pericarditis is inflammation around the heart. So these are symptoms that can happen after other vaccines as well, after viral illnesses. So are not unknown things that can occur. There are cases of this that, of myocarditis or pericarditis that, we don't talk about because they haven't been associated with COVID vaccine. But in regards to COVID vaccine, they have seen more of those cases in males, and usually in the teenage males, sometimes after the second dose. That being said, the cases are very rare, so less than 1%. And so the risk of having a rare side effect, which you could get a rare side effect with all vaccines, the risk is not more than the benefit of getting the vaccine. The amount of children infected by COVID is much higher than the risk of getting any side effect that could be rare associated with the COVID vaccine.
Right. I can understand, like I think you said at the beginning, how parents can be really nervous about, even though this is rare, it is a very serious, potentially serious side effect. How do you how do you approach parents that, or people that tell you, well, the risk of a child getting really, really seriously ill from COVID is also really, really low. It's also quite rare. How would you balance that rare risk of myocarditis and the rare risk of hospitalization for children with COVID?
Well, and the rare risk of myocarditis, so even though there's that rare risk of those who get myocarditis, most of them are going to recover. It's maybe a week of anti-inflammatory medication. So it sounds significant because it is associated with the heart. But on the same note, COVID infection, for as much as people may think it's rare in children, it actually isn't. There have been almost 6 million cases of COVID in children. There have been over 500. I think that the last number that I could see from the end of September was 560 deaths in children from COVID, which is pretty significant. So the illness can be significant. And yes, most children do not get very ill from COVID. That is definitely a blessing. However, children can spread the COVID illness to others. So folks that are at higher risk from getting sick. There are also cases of multisystem inflammatory syndrome in children from the actual COVID infection, which is something much more significant, but also thankfully rare.
Yeah.
So the protection of children versus, protecting children is probably one of the more important things that you would do at this time, based on the fact that children are at school. They are in contact with a huge number of people. They are exposed to people constantly in school, with friends, or in other activities such as sports.
Right.
So they are much quicker, for example, and getting exposed to someone that may have COVID and could be spreading COVID prior to them even having symptoms. So it is important for children to be protected.
Thanks. I really like, that response. I like the fact that you highlighted that there are serious things that could happen to children as a result of getting COVID as well, including the mix that you mentioned, and also for protection of probably more vulnerable people around the children. It might be reasonable for children to get vaccinated. So thanks for highlighting that. The next question I was going to ask was regarding, we've kind of talked about risks and benefits a lot. Are there things that you feel, I know it's hard to predict which child will get seriously ill, but are there things that can help us, that can kind of predict, or risk factors that children could have that could put them at a slightly higher risk? What do we know about this?
Some of the risk factors, actually, that I'm glad you brought this up, because some of the risk factors that put children at higher risk from getting more ill from COVID are the same risk factors in adults, as well as the same risk factors that actually put you at higher risk for getting significant illness with influenza, so the flu. Mm-hmm. And those would be obesity, diabetes, asthma, sickle cell disease, any immunosuppressive condition that you have would definitely put you at higher risk. So these are the folks that we look out for, and there are a lot of people who fit those criteria, especially in our community, and so it's important to protect them.
Great, thanks a lot. I know that there was a press release lately from Pfizer regarding vaccinations for 5 to 11. There was a press release stating that they've been able to confirm safety and effectiveness from their studies, and I believe they've submitted that for approval, or for emergency use approval. Can you give us any information on where that stands currently?
So at this time, from what I have seen, they are submitting approval, but it should be sometime close to October or November that approval will be for the emergency use authorization. However, my understanding is also that CDC had wanted just some more data and increased numbers in some of the trials. It's important that parents remember that children aren't little adults, and so there are lots of trials that take place. That's why it takes time. It's not that the vaccine is untrustworthy, per se. I mean, I know everyone may have different opinions, but it takes time to see in different age ranges the doses that are effective and so on. I mean, just one good example is that it was 100% effective in children 12 to 15, where it's 90 something percent effective in 16 and up. So that's kind of an important thing to remember. So the dosing may be different in that age range. So it does take time to come up with those authorizations.
All right. I know that the CDC talks about layers of protection. We know about layers of protection. So we've talked a lot about vaccine, and you've provided a lot of great responses. So thanks for that. But vaccines are not the only things we have to protect kids. Can you please speak on some of the other things that we can do to make sure that our kids, including adolescents and younger kids, are protected?
Of course. So actually, there's lots of ways, there's lots of non-pharmaceutical interventions, so lots of things besides vaccine. And obviously, you want to make sure you have hand hygiene, cleaning your hands before you eat, making sure you try not to unnecessarily touch your eyes, your nose, your mouth, trying to keep your distance when you're able, especially if it's a larger group or people you don't know or you don't live with. Also, staying away from others when you're ill to protect them, as well as yourself, because when you're already ill with one virus, it's very easy to get sick with another because your immune system is down. And also, if you're coughing and ill, you don't know exactly what you have unless, of course, you were tested. But in that case, you also don't want to get others sick. And last of all, and probably one that people discuss most, is masking. And so wearing a mask is one of the ways in which we protect others, as well as remain protected. So definitely when you wear a mask, and again, the most important thing to remember is no mask is going to work unless you wear it correctly. And Dr. Tomy and I have discussed nose, mouth, it all has to be covered. It has to be a nicely fitting mask that doesn't have huge gaps and is comfortable, because children won't keep a mask on if they can't breathe out of it, if it squishes their mouth, if it gets wet and it feels uncomfortable. So it has to fit nicely, tight around the nose so that it doesn't stick to the mouth, so they can breathe and talk and feel free. But the mask actually will protect the wearer and the person that's in the vicinity from the exchange of all these viral particles. The best mask, besides being the best fitting, would be one that actually does some of that filtering. And not everybody can get an N95 mask, which are the ones that people wear in the hospital or with patients with COVID. But if you wear something that's tightly woven, so whether it be a fabric mask and a multi-layer fabric mask would be better, or a surgical mask, if it fits well and you wear it consistently, then that would be one way to protect the exchange of germs. So that's, 50% of the transmission actually happens before a person is actually sick. So when people feel that they only should wear a mask when they're ill, it might be too late, because you can be transmitting COVID virus 2 days prior to actually presenting with symptoms. So many of us probably know cases that of friends or family who tested positive and you were surprised. So.
Thanks for mentioning those things. I see that Anika is back on screen, and I see that some questions are already coming in. Dr. Contractor, I was really burning to ask you that last question about the impact of the pandemic on you and how you practice, but I think we can talk about that really briefly, and we can go ahead to answer some of the audience questions.
Well, briefly, I'll have to say that going through this pandemic has definitely taught me to be patient and very compassionate, because everybody has questions, and we just all have to remember that we're all in this together, and that this is not us versus them or these guys versus these guys. And the agenda really should be to keep everybody safe. Sometimes we do things that don't feel like they make a big difference, but one step may make all the difference in the world. If you wear a mask, it might protect the other person. And this is where we all have to unite. Really, it's a temporary sacrifice changing our lives a little bit for the common good. So just remembering that we're all in this together, listening to others and respecting how others feel about COVID, about vaccine. So I've definitely learned that.
Thank you so much, Dr. Contractor. I think a big part of what this pandemic has taught me, like you said, is listening to other people, kindness and humility, because the data is constantly changing. We're constantly learning. So just listening and kindness. So I'm going to go ahead and hand over to Anika to take us through the audience questions.
Thank you. I've really been enjoying this dialogue and wish we had more time for it, actually. We do have a lot of questions coming in, and Dr. Tomy, I'm glad that you took the time to squeeze in that last question, because I think one of the things that sometimes we forget is providers are going through this journey with us. And so our providers are impacted day in and day out, seeing patients for whom they care very deeply, who are getting ill, or in their personal lives, family members who are being impacted. And so I'm sure that has impacted how you have brought yourselves to your practice every day. So thanks for sharing that with us. We have started to have some questions come in, and they're starting to really come in. So I'm going to try to combine any that I can. Some of them I know you have touched on already. So one of the questions, and there were actually two, I'm going to try to find the other one, was around the misinformation. So this person says one thing they feel that is going to be a biggest detractor for getting children and adolescents vaccinated, particularly children in this case, is misinformation going around. And so how can we, as the public, convince our friends and neighbors who believe misinformation to get their kids vaccinated? And so you touched on some of those things in the responses, but if you could just, in a nutshell, say one or two things that the common person can say to a friend or neighbor when they're questioning whether or not to get their child vaccinated. So either of you.
Well, one of the things I'd like to mention is that when people hear mRNA vaccines, sometimes they think that it's going to be the same as DNA, and that there's some sort of insertion of some code that's happening in the DNA. But when you really look at the actual vaccine, mRNA vaccines, first of all, they don't have live virus. So you're not injecting anything that is viral to make you sick. Second of all, the mRNA is actually just a code that teaches your body to create a spike protein very similar to that which is produced by COVID, by the coronavirus, those little spikes that are on the actual coronavirus. And that spike protein is what your body recognizes and develops a response to. Now, the one that you produce is not actually coronavirus. It's just coding for something that looks like that, first of all. Second of all, that mRNA doesn't enter your nucleus, so it doesn't get to your DNA. It doesn't actually change you, or, that's not how the science works. When your body sees the spike protein, it, momentarily freaks out and it thinks, uh-oh, I'm getting sick. And so it creates the antibodies, which will be basically your little reserves, your army in reserves that's kind of standing there waiting for the real infection. So once it realizes it's not the real infection, then of course you're not going to get sick. So that's important. The other thing to remember is that COVID vaccine doesn't have any metal parts in it. There's no magnetic potential because there's no metal in the vaccine. So I'm not sure where that misinformation started. So there really shouldn't be any. I know people have said things about magnetizing and tracers and stuff, but there's no metal in the vaccine. There's no eggs, there's no gelatin, there's no latex, there's no preservatives. So this vaccine is actually pretty clean. So it's probably better studied than a lot of the things that people put in their body.
Dr. Tomy, did you want to respond as well?
Yes, I'm not sure I have a great response to how we solve the problem of misinformation. I can tell you in my own interactions with people, I'm learning to listen a little bit better. I like something that Dr. Contractor had said in previous conversations that we've had. Everyone's process is different. And I think for me as a provider, for me as a sister friend, it's important for me to acknowledge that everybody's process is different. There are people that can give you several stories of family members that had COVID and ended up in the hospital. I can give you several stories of people that got COVID and ended up with strokes right after I told them to get vaccinated. But there are also several families that have people that have done really well after a COVID infection. And they just don't personally feel that risk as other people. So people are in different stages of their process. I'm learning to listen a little bit more to really understand what those concerns are, and to the best of my knowledge to provide an educated opinion on, sometimes if I'm talking with the patient, I try to tailor my opinion to that patient, to what that patient's risks are, to what the potential benefits for that patient are. So just learning to listen, be kind, and just understanding, respecting people, and just understanding that everybody's process is different.
Right. No one should feel forced or that they were pushed or bullied into doing anything, because we know, like Dr. Tomy said, everyone is trying to look out for their children's and their family's best health. So just listening and being educated. So also listening on the opposite side, listening to the data that's presented.
Mm-hmm. Mm-hmm. So a question came through about the trials for children. The question is, there seems to be a limited amount of children in the trials. Should we be concerned about that?
So it's true, there is a limit, but it really depends. First of all, they have to get the children enrolled, and you want to make it so that the trial is valid. They all have to be followed. It's true, everyone would want a larger volume of participants, obviously, but getting a larger amount in a trial means delay in getting the vaccine where it needs to go. Now, I know that people will say, well, what difference does it make? Because then you're doing a bigger trial, and then you feel a little better about safety. But if in the trial that's being conducted, the safety profile is incredibly high, then you have to decide at a certain point, it has to be decided that is it also ethical to then just keep that vaccine from being available to those who can have it when other people are getting ill and dying from COVID. So it is a big dilemma.
Yeah,
so I don't really have a very concrete answer, but I think that's how I feel about it.
And I think that's a really practical response. We're in a pandemic, and so we have to make choices about how we move forward to move through it. And so that's a really practical answer, Dr. Contractor.
And to add to, I was also, when I first saw the trials, I realized that those numbers were indeed small in terms of being able to detect, really rare things. However, that's why the surveillance is continuing. So that's why they continue to encourage people to report any adverse reactions to the vSafe platform, and providers are also encouraged to report any adverse effect on the VAERS surveillance system. I think the vSafe is like an app that you can get on your phone, and every couple of weeks the CDC, FDA, they gather all this data. So I'm sure that we'll continue to get data. And as far as Dr. Contractor stated at the beginning, the FDA has actually asked Pfizer to make sure that they enroll more people as they're doing more studies. So hopefully we don't have this concern about the original data in future studies.
Right. Thank you, Dr. Tomy. This question is around young people who might be admitted to the hospital. So for the pediatric age group, once a patient is admitted for a COVID infection, are the same types of treatment given as those given to adults? So this is at the point that we have a young person who's admitted and is needing treatment in the hospital for a COVID infection.
Well, because the COVID infection is a viral infection, most of the time the care is supportive. So it's going to be oxygen if needed, treating any secondary pneumonias. I recently had a child who had pneumonia that they developed, any other infections that could be happening at the same time. We've had kids with COVID and strep. We've had kids with COVID and RSV. So all different combination of illnesses that can happen. And I know possibly people are considering, we're thinking about the antibody treatment at the hospital. And yes, children can get it. It wouldn't be everybody. It would be, if they're sick enough to be in the hospital, and there are different criteria. But yes, those treatments are available for children.
Okay. You brought up something, I was making a note here, and something that I know in talking with various providers has come up. Incidents of strep, RSV, and it's flu season. And so I'm sure you're both seeing this in your practice. And so what would you say, and this is not something that was chatted in, but you prompted this, Dr. Contractor, what would you say to a parent, a guardian, a caregiver to a child that says, oh, this looks like the annual RSV that my kid gets, and they just say, oh, we know what to do, we know how to handle it, let's move forward. Or seems like flu, we know what that looks like, how do we move forward? What would you say to that person who is making that judgment in the midst of this pandemic?
I have to say that I have, like Dr. Tomy said, I am learning as I go. And this pandemic has taught us that there is so much that we thought we knew and didn't anticipate seeing now. We thought we knew exactly when a kid looks like flu. I can tell you, like a year ago, I would look at a child and say, oh, he's got those glassy eyes, I bet you he's going to have a flu. And they'll come back positive. And you feel good about it because you knew what was going around. Now, not only do we know what's going around, we know there's tons of RSV. We know there's a lot of rhinovirus. And flu. Yes, I've definitely seen positive flu in the office, at least for the last few weeks. But is it so obvious? Not always, because you know what? COVID could act that way too. So we end up having to test because we can't necessarily say for sure that it's not COVID. And when you're in the midst of a pandemic, you can't just assume that and I'm just going to be honest, the hardest one to convince is when they say this is just allergies. And it might be a child who's never had allergies before, and it looks like classic allergies, but not always is it just allergies. Sometimes that cough is real and you just don't know whether it's from COVID. So what I would tell parents is you're right. You're right. This is probably RSV. It looks just like RSV. He's wheezing, etc. But you know what? We're also in a pandemic, and it would not be responsible if we didn't make sure that we knew it wasn't, at least at this time. And so most parents understand, and they'll just, we do the testing and we make sure, because yes, if it's RSV in that 3-year-old, maybe the 20-year-old in the house that has cancer won't get it. But if it happens to be COVID, wouldn't you rather know? So it's really better to be sure. But you're right. It does leave us scratching our heads sometimes when we think we knew that it was going to be a positive strep. But gosh, actually, that sore throat was part of the COVID. So,
Thank you for addressing that. And as a parent, I know that happens. You think oh, and my child, I know what this is. But we can't make those same assumptions right now, is what I'm hearing from you. So there was a question about masking. So how effective is wearing a disposable mask over and over? Do you really need to throw it away after one wearing?
Well, the current recommendation, especially for children with a disposable mask, is that for as much as a disposable mask, I mean, honestly, in other countries and other situations, they have been worn over and over, because the integrity of the mask probably doesn't, just go away because you wore it for, maybe 6 hours or 7 hours at school, but you can't wash it, right? So you don't know what's sitting on it. You can't wash it. Children have that paper, the disposable mask on. They might sneeze in it. They might get some, they'll get saliva in it. Stuff gets in there, mucus, and then you can't really clean out, a mask like that. And so once it gets soiled or contaminated that way, then there's risk for just overgrowth of other stuff. So for that reason, it's not ideal to use it over. Now, if you have your disposable mask and you're in a little bag, a little Ziploc bag in your purse, and you're going into a store, you put it on, then you put it away. I guess, over the course of the day or over the course of the next 2 days, if that's the mask you wear every time you go into a store, then that would probably be fine. But I'm thinking of the child, for example, that wears the disposable mask to school all day, and it's just going to be contaminated and contacting all kinds of things.
All kinds of things.
All kinds of things. They're kids. Come on.
Yes.
So how do you suggest we discuss vaccine hesitation with parents and children who are concerned about myocarditis from vaccination? And I know you touched on this a little bit earlier, well, actually pretty deeply earlier, about myocarditis and some of the risks that exist, but is there like a quick, like a one-liner, because there's a one-liner when we talk about COVID, that we could say, if we're talking with a friend who may have questions about the vaccine, is it, I encourage you to talk with your primary care provider for your child. Is that the easiest and best information at this time? Or is there something else we can share?
Well, obviously talking to your provider would probably be the best thing to do, but is that going to be the convincing line? Probably not. So the convincing line, I would say, would be, if you had a way of preventing potentially deadly illness, wouldn't you take advantage of it, even knowing that there might be a rare side effect? Like, I could wear a seatbelt in a car, and it might bruise me if I get in a crash, but would it prevent me from dying in a crash? It might do that more than hurt me. So I know maybe that's not the ideal example, but I'm just thinking, when you think about risk and benefit, rare side effect, you've gotten so many, if people get a lot of other vaccines, there are definitely rare side effects that could happen, versus the millions of people that have gotten vaccine and been fine and actually have had good response to it. So that wasn't sorry.
I'm going to add something here. What the data actually suggests is that if, I feel, my personal belief, and I think a lot of scientists agree, that at some point, most people will come in contact with COVID as we think about more transmissible variants. So at some point, most people will come in contact with the virus. And if I think it makes more sense when you do have that meeting date with the virus for you to be vaccinated than for you not to be vaccinated. What the data suggests is that the risk of getting, the excess risk of getting myocarditis from the virus somewhat exceeds the risk of the COVID vaccine, from getting myocarditis from the COVID vaccine. The CDC data suggested. There was actually another study that was just released, I think, from Israel, where they had this really nice table also talking about the excess risk of myocarditis in children. And the risk was still higher with having COVID than having the vaccine. That being said, it's an important nuanced conversation because everybody's risk is different depending on what their other underlying comorbid conditions are. So I definitely would refer that question to more like a one-on-one with providers if the patient or if the person continues to have that concern.
So it continues to be very nuanced throughout this journey, right? I think we're all looking for that one answer. Give me the answer. And in many situations, there's not the one answer. So,
I mean, just to throw out, I mean, you can get myocarditis just in the general population. I mean, there's anywhere from 10 to 20 cases per like 100,000 people anyway in the general population from other things. So maybe that helps. I mean, it helps, but in convincing.
Right. So a straight question here that I think both of you will have similar, if not the exact same response. Should children also get the flu vaccine this year?
Yes.
Of course. I was just waiting for Dr. Tomy. Yes, kids should get the flu vaccine. We've actually seen lots of positive cases of flu, and there's no reason you can't get flu vaccine and COVID vaccine together. And just because COVID is is the pandemic doesn't mean flu's not out there. We've seen it, and there are deaths from flu every year. So prior to COVID, flu was one of the #1 causes of death in children from a vaccine preventable illness. And so definitely to be vaccinated against flu and COVID would be probably ideal.
That's a great point to make, Dr. Contractor. Prior to COVID, flu was the thing that we were concerned about. Continuing down the flu path-ish, do you think we will have to continue to take the COVID vaccine for years to come, the same way that we get the flu shot every year? And I know that we're still trying to understand this thing, but based on your level of understanding, what are you thinking? Either one of you can take that one.
So the answer to that is possibly. There is constant data coming out. Now, to answer that question also, one of the conversations that I've seen that has been going on in the science community is what kind of immune response do people develop to either the natural infection or COVID vaccine. So we talk a lot about antibodies, but antibodies are not the only way we fight infection. We also fight infections through other cells that your body has. They are called the T cells. And sometimes those are longer lasting than the antibodies. So even when the antibodies are waning, sometimes you still continue to have some level of protection. Now, there are things that can put people at risk of having less protection. Some of it is age, and that's why we're talking about boosters for older people. Some of it is people that have immunocompromised states. So we're talking about boosters for them also. But you would notice that the CDC held off on boosters for everyone because they're still trying to understand how long that protection lasts from the vaccine. So again, the answer to that for right now is possibly, but not. We don't know for sure.
All right, I'm going to try to squeeze in one more big question, and then I have one more question that I think we can answer and follow up in the chat. So the last big question is, for a child with moderate symptoms, what is the advantage to having the child tested? For example, if a child has symptoms and the parent decides to quarantine, as long as the symptoms don't progress, should the child still get tested? And if so, why?
So testing is never something that a parent has to feel they have to do. However, that being said, testing plays different roles. So #1, not only does it help you understand the illness and understand what it is, and maybe that somehow, may be helpful. But the other thing is it does help the length of quarantine. So the length of quarantine versus isolation. So isolation is if a person is sick, they try and stay away from others. Quarantine is potentially if, you don't know if it's COVID for sure, and you're may have been exposed and you're staying away to kind of monitor symptoms as they develop. So it helps you understand that. It also helps to inform family members or school or anyone that you could be in contact with during the course of the previous, few days prior to becoming ill, or anyone that may be coming in contact with you that you actually have COVID, which is, in a pandemic, a very transmissible disease. So that's where it would be helpful. Does it help you to know so you can treat the child? Not necessarily, because the treatment is going to be the same. It's going to be fluids, rest, symptomatic care. But it does help just kind of on a more broad base to understand the transmission, how long to quarantine, and it also helps us understand the amount of COVID in the community, so you know how much is being spread.
And I'm going to add something to that, which may seem somewhat unrelated, but also related. The amount of COVID in the community is something that is very, very important to know, because it also helps us understand risks to children in schools, risks to adults in nursing homes. It helps us there's a lot of information we get from knowing what level of transmission that we have in the community. So this is not only something to be done for the child, it's also something to be done to keep whole communities safe. And I know we focus a lot on the individual health, individual safety, individual responsibility, but one of the best ways to keep children safe is to make sure that our community levels are down. There's a lot of data that we have that suggests that if community levels are down, there's less transmission in schools. And if there's less transmission in schools, there's also less transmissions to older, more vulnerable adults. So community levels being down, understanding what our community levels are is very, very important. Also, if community levels are down, we also know that there's less. Whenever you look at the data of vaccine effectiveness, you would see that when community levels are down, those vaccines, it's not like they're necessarily more effective, but you just those numbers are a little bit higher because in general you're seeing less transmission.
Right. And Dr. Tomy, you said something that I'm going to end us on, that I think really drives the point home of this conversation, our previous conversations, and pretty much all of our conversations related to COVID is, our decisions every day impact our communities. And so this is not a time for us to say, oh, for me, this is the right choice. We have to say, for me, this is the right choice. And how does that impact the community? And so you hit on that, Dr. Tomy, and I think I see Dr. Contractor nodding. That's part of everything that we've been talking about through this pandemic. We don't function as one single person, but all the people we engage with. So I'll give you, I know we're running close on time, but I'll give you both another minute or so if there's anything that you want to share with our viewers tonight that you think is most important to walk away from this conversation with.
I definitely want to echo those comments that COVID affects us all, and COVID affects us whether you get the disease or not. So there's a lot of anxiety, there's a lot of depression, there's a lot of paranoia surrounding those things that we don't know. So our job as a community is to work together to get through it. It is hopefully just another hurdle in our lives that we're going to all get through together, but only if we work together and realize that we all share a common goal, and that's to be healthy and safe. And so that's what we all have to remember, that we're all in this together.
Thank you, Dr. Contractor. Anything from you, Dr. Tomy?
So from me, I think it's important to know that we need to focus on the layers of protection. So I heard an example of the Swiss cheese, model. Sorry, I'm not a cheese fan, but when when you're thinking about that Swiss cheese model and you have different slices, there's less chance of something getting through if you have all the layers versus if you have one thing and you don't have the other. So I'm talking about, vaccine, I'm talking about masking, I'm talking about ventilation in schools, I'm talking about hand washing, I'm talking about, distance whenever you can do that. I'm talking about testing. I'm talking about just in general being healthy. So eating well, sleeping, exercising, going out and exercising before we get to winter. All of those things build immune system, build the immune system, help keep you healthy in general, and hopefully less susceptible to illnesses.
Definitely the Swiss cheese approach, Dr. Tomy.
Yes.
So that is all the time we have for tonight. I know that some other questions came through related to data, and so we'll still be able to post some links in the chat and follow up to this conversation. So please continue to check back for that. Questions around data, state and county, and then certain areas of our service area. So we'll definitely look into that. And so I encourage everybody to come back and visit this thread to see some of those responses. And most importantly, I want to thank Dr. Tomy and Dr. Contractor for spending some time with us this evening after what I know is a very, very busy time in your practice, I'm sure. And I want to thank everybody who tuned in tonight and engaged in the conversation and shared your questions and concerns. These are the conversations that we need to be happening in our community for us to really build our knowledge base, to make informed decisions about how to keep ourselves and our families healthy. So our team has been so great. I want to thank our marketing team for keeping up with the questions and posting information and resources in the chat. And so please follow any link there if you're looking for access to vaccination or testing. And, next time, we hope that you'll join us again here. So we'll tell you good night for now. Thanks, everybody.
Good night.